Did you know that choosing the wrong Medicare plan could cost you thousands of dollars over your retirement? Today, I'll show you exactly how to avoid this expensive mistake. If you're approaching 65 or already on Medicare, you've likely heard the terms Medicare Advantage and Medigap thrown around. But what do they really mean, and how do you decide between them? It's a choice that affects not just your wallet, but your access to doctors, your peace of mind during health challenges, and your overall quality of life in retirement. You're not alone in feeling a bit overwhelmed. Millions of Americans grapple with this decision every year. Let's break it down calmly and clearly so you can feel confident moving forward. First, a quick overview to set the stage. Medicare is the federal health insurance program primarily for people 65 and older, though some younger folks with disabilities qualify too. It helps cover hospital stays, doctor visits, and more, but it doesn't cover everything. That's where the confusion often starts. Original Medicare, which includes Parts A and B, leaves gaps, like 20% coinsurance on many services, that can lead to unexpected bills. To fill those gaps, you have two main paths. Medicare Advantage plans, also known as Part C or Medigap policies, which are Medicare supplement insurance plans sold by private companies. The problem is, with so many options and annual changes, picking the right one isn't straightforward. According to the Centers for Medicare and Medicaid Services, or CMS, more than 34 million people were enrolled in Medicare Advantage plans as of early 2025, representing about 55% of all eligible Medicare beneficiaries. That's a huge number, but it also means nearly half stick with original Medicare, often paired with Medigap. Why the split? Because no single approach fits everyone, and making the wrong choice can be costly. Consider the latest statistics for 2026. The standard monthly premium for Medicare Part B, which covers doctor visits and outpatient care, is rising to $200.90, up $17.90 from 2025. For Medigap plans, average premiums can range from around $189 per month for someone at age 65 to $238 at age 75, depending on the plan and location. Medicare Advantage plans, on the other hand, have an average premium of just $14 per month in 2026, down slightly from the previous year. But premiums are only part of the story. The real costs come from deductibles, copays, and out-of-pocket expenses. For instance, in original Medicare without Medigap, there's no annual out-of-pocket limit, so a serious illness could lead to unlimited expenses. Medicare Advantage plans cap in-network out-of-pocket costs at $9,250 for 2026, which provides some protection but comes with network restrictions. Prescription drugs add another layer. Part D plans now have a $2,100 out-of-pocket cap for 2026, up from $2,000 thanks to recent reforms. Yet, if your medications aren't well covered, you could still face high copays before hitting that cap. How does this affect your daily life? Imagine you're like many retirees I've heard from. Let's say you're managing a chronic condition like diabetes or heart disease. With the wrong plan, a routine specialist visit might cost you $40 instead of $10. Or your preferred hospital might be out of network, forcing you to travel farther or pay more. One common concern is travel. If you spend winters in Florida but live in New York, Medigap with Original Medicare lets you see any doctor nationwide who accepts Medicare, while many Advantage plans limit you to local networks. Another worry is changing health needs. If you develop a new condition, switching plans later might involve health questions or higher rates for Medigap in most states. Surveys from sources like AARP show that confusion about these options leads many to stick with what they have, even if it's no longer the best fit. Nearly 40% of beneficiaries don't review their coverage annually, missing out on potential savings or better benefits. And with healthcare costs rising, Medicare spending on drugs alone is projected to be impacted by new negotiated prices for 10 high-cost medications starting in 2026. Ignoring the choice between Advantage and Medigap could mean paying hundreds more each year than necessary. I understand the overwhelm. Terms like deductible, the amount you pay before coverage kicks in, or coinsurance, your share of costs after the deductible, can feel like a foreign language at first. And with enrollment periods like the initial enrollment period around your 65th birthday, or the annual open enrollment from October 15th to December 7th for changes effective the next year, timing adds pressure. But rest assured, official resources like Medicare.gov and CMS provide clear, unbiased information to guide you. As someone who's studied these programs extensively, drawing from government data and real retiree experiences, I can tell you that knowledge is your best tool here. No need to rush. We'll go through this step by step. The good news is that whether you choose Medicare Advantage or Medigap, both can provide solid coverage when matched to your needs. But getting it wrong? That might mean surprise bills during a hospital stay or denied claims for a specialist. For example, if you opt for Advantage without checking networks, a sudden emergency while traveling could cost you dearly. Or if you skip Medigap and face a major surgery under Original Medicare, that 20% coinsurance on a $50,000 bill is $10,000 out of pocket. These aren't rare scenarios. CMS reports that out-of-pocket costs vary widely, and with premiums rising, the gap between plans is growing. Common concerns I hear include, will my doctors be covered? How do I handle prescriptions? What if I need dental or vision care? And perhaps the biggest, which one will save me money long term? These are valid worries, especially as retirement budgets tighten. With over 66 million people on Medicare overall and enrollment in Advantage plans climbing steadily, the pressure to choose wisely is real. But by understanding the pros and cons, you can avoid pitfalls like lifetime penalties for late enrollment or locked-in plans that don't adapt to your changing health. Now that you understand the challenge, let's look at your options. I'll explain everything step by step, starting with how Medicare works overall, then diving into the details of Medicare Advantage and Medigap, with fair comparisons and real examples to help you see what might fit your life. Let's start with the basics of how Medicare works, because understanding the foundation will make comparing your options much clearer. Medicare is divided into four main parts. Part A covers hospital stays, skilled nursing facility care, hospice, and some home health services. Most people get Part A premium-free if they or their spouse paid Medicare taxes for at least 10 years. Part B covers doctor visits, outpatient care, preventive services, and durable medical equipment. In 2026, the standard Part B premium is $290 per month, with an annual deductible of $283. Parts A and B together are called Original Medicare, provided directly by the federal government. Part D covers prescription drugs and is added separately, either through a standalone plan or bundled into a Medicare Advantage plan. For 2026, Part D plans have a maximum deductible of $615, and there's now a $2,100 annual out-of-pocket cap for covered drugs, meaning once you reach that amount in copays and coinsurance, you pay nothing more for covered prescriptions the rest of the year. Part C is Medicare Advantage, an alternative to Original Medicare offered by private insurance companies approved by Medicare. These plans must cover everything in Parts A and B, and most include Part D drug coverage too. Now, here's where your choice comes in. You can stay with Original Medicare and add coverage for the gaps, or switch to a Medicare Advantage plan. Let's look at the two main paths fairly and in detail. The first option is Original Medicare plus a Medigap policy plus a separate Part D plan. With this approach, you keep traditional Original Medicare, Parts A and B. Then, you buy a Medigap plan, also called Medicare Supplement Insurance, from a private company to help pay for the gaps in Original Medicare, like the 20% coinsurance on Part B services or the Part A deductible. You also add a standalone Part D plan for prescriptions. Advantages of this option: you have tremendous freedom. You can see any doctor or hospital nationwide that accepts Medicare, which most do. No networks to worry about, no referrals needed for specialists, and coverage is consistent when you travel or spend time in another state. Out-of-pocket costs become more predictable because Medigap covers most or all of those gaps. For example, popular plans like Plan G cover the Part B coinsurance and the Part A deductible after a small one-time fee. Disadvantages: monthly premiums are higher. In 2026, average Medigap premiums are around $189 per month for a 65-year-old, rising to about $238 by age 75, depending on your location and the plan letter you choose. You'll also have separate Part D premiums, and you'll manage 3 different cards: your red, white, and blue Medicare card, your Medigap card, and your Part D card. This option works best for people who value maximum flexibility, travel frequently, see multiple specialists, or simply prefer the security of knowing they can go anywhere Medicare is accepted without restrictions. The second option is a Medicare Advantage plan, also known as Part C. Here, a private insurance company provides your Medicare benefits in one bundled plan. It covers everything Original Medicare does, Parts A and B, and most plans include Part D prescription coverage. Many also add extra benefits not in Original Medicare, like routine dental, vision, hearing aids, or even gym memberships. Advantages: premiums are often lower. The average Medicare Advantage premium in 2026 is about $14 per month, and many plans have $0 additional premium beyond your Part B amount. Everything is on one card, making it simpler to manage. There's an annual out-of-pocket maximum, $9,250 for in-network services in 2026, which protects you from unlimited expenses. And those extra benefits can be valuable if you use them. Disadvantages: most plans have networks, HMOs, or PPOs, so you may need to stay in-network for lower costs, and HMOs often require referrals for specialists. Rules and benefits can change each year, and coverage might be limited if you travel outside your plan's service area. While the out-of-pocket cap provides protection, copays can add up if you have frequent care. This option works best for people who want to minimize monthly premiums, don't mind staying within a network, value the included extras like dental or vision, and generally receive care in their local area. To make this real, let me share a couple of concrete examples based on typical situations. Suppose you're like John, a 68-year-old retiree in Texas who takes a few medications for blood pressure and cholesterol, sees his primary doctor a few times a year, and occasionally a cardiologist. With Original Medicare plus Medigap Plan G plus Part D, he pays the Part B premium of $290, about $180 for Medigap Plan G, and $40 for Part D, total around $423 per month. But his out-of-pocket for doctor visits or hospital stays is minimal, often $0 after the small Plan G deductible. With a local Medicare Advantage plan, premium $0 beyond Part B, but copays like $15 for primary visits, $40 for specialists, and $10-50 for medications. His estimated yearly copays might total $800–$1,200, depending on usage. Another example: Mary, 72, from Arizona, travels often to visit family and sees specialists regularly. Original Medicare with Medigap allows her nationwide access without worry. A Medicare Advantage plan might restrict her to in-network providers, potentially causing issues when away from home. Now, some common questions I hear. Can you switch later? Yes, during annual enrollment from October 15th to December 7th of each year, or if you qualify for a special enrollment period due to moving or losing other coverage. What if you travel? Original Medicare with Medigap generally works anywhere in the U.S. Many Advantage plans have limited out-of-area coverage. What about dental or vision? Original Medicare doesn't cover routine care, but many Advantage plans do, though Medigap doesn't. How do you know which is right for you? It truly depends on your health needs, doctors, medications, budget, and lifestyle. In the next part, we'll turn this knowledge into action with a clear step-by-step plan to compare costs for your specific situation, address any remaining concerns, and help you make a confident decision. Now that you understand the two main options, Original Medicare with Medigap and Part D, or a Medicare Advantage plan, let's turn this into a practical plan you can follow right away. The goal is to find the coverage that best matches your doctors, medications, health needs, and budget for 2026. Here's exactly what to do, step by step. Step 1. Gather your information. Take about 15 minutes to make a simple list. Write down all your current medications, including the exact names, dosages, and how often you take them. Your doctor's names, specialties, and any hospitals you use. How often you typically see doctors or have tests. Any planned procedures, ongoing treatments, or changes in your health you expect in the coming year. This information is essential because it determines your real costs under each option. Step 2. Use the official Medicare Plan Finder tool. Spend about 30 minutes on Medicare.gov. Click on Find Health and Drug Plans. This is the free, unbiased government tool that shows all available options in your area. Enter your ZP code. Add your medications exactly as listed. Include your pharmacies if you have preferences. The tool will estimate your total yearly costs for Medicare Advantage plans and for standalone Part D plans to pair with original Medicare. Important: focus on the total estimated yearly cost, not just the monthly premium. This includes premiums, deductibles, co-pays, and your specific medication expenses. A plan with a $0 premium might end up costing more if your drugs or doctor visits have high co-pays. Step 3. Check your doctors and networks. If you're considering Medicare Advantage, take 15 minutes to verify your providers. Use the plan's online directory or call the plan directly. Contact your doctor's offices and ask, "Do you accept this specific Medicare Advantage plan for 2026? Networks change yearly, so don't assume, confirm. For original Medicare with Medigap, as long as your doctor accepts Medicare, which most do, you're covered nationwide. Step 4. Compare your top 2 to 3 options. Side by side, spend 20 minutes creating a simple comparison chart. Include monthly premiums. Part B is $290 for most in 2026, plus any Medigap or Advantage premium. Annual deductibles. Estimated costs for your medications. Copays for doctor visits and specialists. Out-of-pocket maximum up to $9,250 in network for Advantage plans in 2026. No limit with original Medicare unless you have Medigap. Extra benefits you'll actually use, like dental or vision in many Advantage plans. Remember, average Medigap premiums are around $189 per month for a 65-year-old, while many Advantage plans have low or $0 additional premiums. Step 5. Enroll in your chosen option. Once you've decided, enrollment takes about 20 minutes. You can do it online at Medicare.gov. Call 1-800-MEDICARE, 1-800-633-4227, available 24/7. Work with a licensed agent at no cost to you. They can help compare but may not show every option. The recent annual enrollment period for 2026 coverage ran from October 15 to December 7, 2025. Since we're now past that deadline, most changes are locked in until next fall. However, you may qualify for a special enrollment period if you've had a life change like moving, losing other coverage, or qualifying for extra help. Contact Medicare.gov or 1-800-MEDICARE to check. Now let's address some final concerns I often hear. What if I make the wrong choice? The good news is nothing is permanent. You can review and change during next year's annual enrollment, or sooner if you qualify for a special enrollment period. Many people adjust as their needs evolve. What if I can't afford the costs? If your income is limited, under about $23,475 for a single person, or $31,125 for a couple in 2025 guidelines, you may qualify for extra help with Part D costs or Medicare savings programs for premiums and more. Apply through Social Security or your state. Do I need to act right now? If you're happy with your current coverage, you can review it any time, but major changes typically happen during enrollment periods to avoid penalties. Here are trusted, free resources for more help. Medicare.gov, the official site for plan comparisons and enrollment. 1-800-MEDICARE for personalized guidance. Your local state health insurance assistance program, SHIPE, free, unbiased counseling. Find yours at shiphelp.org. SSA.gov for benefits and extra help applications. Avoid unsolicited calls or high-pressure sales. These official channels are safe and don't charge fees. I know Medicare seems complicated at first, but you've just learned the essentials. Thousands of people successfully navigate this every year, and you can too. Take it one step at a time. Gather your information, use the Plan Finder tool, compare total costs, and choose what fits your doctors, medications, and budget. Remember, the best plan is the one that works for your unique situation. There's no one-size-fits-all. Whether it's the flexibility of original Medicare with Medigap or the bundled benefits and lower premiums of Medicare Advantage, the right choice brings peace of mind. The most important thing is that you now have the information you need to make an informed decision. You're not alone in this process. If this video helped clarify Medicare Advantage versus Medigap for 2026, please give it a thumbs up and subscribe for more straightforward Medicare guidance. In my next video, I'll cover changes to prescription drug coverage in 2026. Have questions about your situation? Leave them in the comments. I read and respond to as many as I can. Thank you for watching. I wish you confidence and good health in your Medicare journey. Take care and be well.